To prepare for shortages of hospital beds and medical staff amid the prolonged COVID-19 pandemic, the government has decided to modify the guidelines for lifting quarantine for those infected with the virus. Discerning between patients who need hospitalization urgently and those who don't has become essential in order to prevent the collapse of the healthcare system before a vaccine or treatment is developed.
Back in March, 3 Daegu and Gyeongsangbuk-do residents infected with COVID-19 eventually passed away in their homes before they were hospitalized. It happened because hospitals were full to capacity, as all COVID-19 patients, regardless of the severity of their condition, were hospitalized. Quarantine authorities are concerned that more patients requiring intensive treatment may fall victim to the coronavirus due to a shortage of hospital beds.
만약에 의료 시스템이 붕괴되면 치료제가 있고 없고의 문제가 아니라 그보다 훨씬 더 심각한 재앙적인 상황이 초래됩니다.
To prevent this from happening, doctors will be allowed to classify patients according to the severity of their symptoms. High-risk patients who are severely obese, 65 or older, have diabetes, dementia, unstable blood pressure and breathing, or decreased consciousness will be hospitalized first. State-designated and tertiary hospitals with isolation wards will treat high-risk patients, while other designated medical centers or regular clinics will be in charge of patients with light symptoms. Patients who meet the criteria for lifting quarantine but don't have guardians to monitor if their condition becomes worse again will be sent to quarantine centers instead of their homes. Those who refuse to relocate to other hospitals or wards at the instruction of their doctors or local governments, as well as those who refuse to enter quarantine centers, will have to pay 100% of their medical bills.
백신 등의 그런 근본적인 해결 방안이 마련되기 전까지는 우리의 의료 체계와 방역 체계 그리고 사회 시스템이 감당 가능한 수준으로 코로나19의 발생 규모와 속도를 억제해서 통제하는 겁니다.
Quarantine authorities believe the second wave of COVID-19 has already begun in the Seoul metropolitan area. Therefore, overhauling the healthcare system before the virus spreads further in fall and winter is urgent.